I'd like to call to order the Board of Legislators meeting of October 12th and ask if Legislator Bill Dibble would lead us in the Pledge of Allegiance.
I pledge to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
And today, if Legislator David Decker would give the invocation.
Please bow your heads and pray with me. Father God, we thank you for this day. Thank you for freedoms that we have given to us throughout history. Military, thank you, Lord, for their sacrifice. Thank you, Lord, for the present first responders who EMS, people in the emergency rooms and hospitals, police, state police. We just thank you that they continue to safeguard these freedoms. We ask, Lord, now for wisdom and guidance as we deliberate any business that needs to come before the county. We thank you, Father, that you are mindful. We are mindful of your love for us. We thank you for protection as we leave here today and go our separate ways. Thank you for your holy things. In Jesus' name, amen.
Thank you, Legislator Decker, for the invocation, and Legislator Dibble for the Pledge of Allegiance. Roll call.
Mr. Barnes. Mrs. Burdick.
Here.
Mr. Crandall.
Here.
Mr. Curran. Mr. Decker.
Here.
Mr. Dibble.
Here.
Mr. Fanton. Mr. Graves.
Here.
Mr. Harris.
Here.
Mr. Havey.
Here.
Mr. Healy.
Here.
Mrs. Hopkins.
Here.
Mr. Ricky.
Here.
Mrs. Root.
Here.
Mr. Stockin.
Here.
12 present, 3 absent. You were provided a copy of the board meeting minutes of September 27th. At this time, we need a motion to approve those minutes.
Motion made by Legislator Dibble, seconded by Legislator Havey. Discussion. Those in favor of their approval say aye.
Aye.
Opposed? Motion is carried and those are approved.
You were also provided a copy of the Committee of the Whole meeting minutes of September 27th, and we need a motion to approve those minutes.
Motion is made by Legislator Dibble, seconded by Legislator Root. Discussion. All in favor of their approval say aye.
Aye.
Opposed? And that motion is carried and those minutes are approved. Have podium will travel. We have, for privilege of the floor today, Jones Memorial Hospital CEO James, or Jim Helms, is with us and going to give us a few updates on the hospital. So Jim, if you want to come forward, and the floor will be yours. Jim is the new CEO, and we've had former CEO Eva Benedict come in and meet with the board numerous times, update us, and we're so glad that you're here, and congratulations on your new appointment. It's like the building's on fire, who wants to be in charge of it, but my understanding is things have gone quite well, and that's what you can share with us here today. So welcome, the floor is yours.
Appreciate it. Thank you. So you have a better chance of hearing me. I'll remove my mask. So greetings, Chairman Crandall, county legislators. I want to thank you for allowing me a little bit of time here on your floor today to give you an update on Jones Memorial Hospital. For those that don't know me, James Helms, the CEO for Jones, only since July However, I've been with the Jones for over 8 years now in various roles, to include Chief Financial Officer, and in healthcare for over 20 years, working in the region to include St. James Hospital. I understand that historically you would get updates from the hospital to the county, and this may go back quite a ways, but as I was talking to Legislator Crandall, I thought that would probably be not just wise for today, but probably as an ongoing cadence as well, being your only full service acute hospital in the region and serving such a large swath of area, not to include just Allegheny County, but of course some of the northern Pennsylvania and even some of Steuben County. I know you'd certainly be interested in how things are going at the hospital. Many of you, I'm sure, would like to hear about the construction update. But in the interest of time, what I'd like to do is ask that I be able to return to give you an update on the hospital construction, the $17 million grant project, as that is starting to move along. And we're starting to make some progress, as you see some excavators out on site finally. And I say finally, because it's a long road of all the planning. But I'll be able to give you a much more robust update in the very near future. Jones Memorial has recently undergone a multi-year financial turnaround plan, really under the leadership of Eva Benedict is when we kicked that off. And so we did complete that a little while back. So I'm happy to report to you that overall, the hospital is strong. But that doesn't mean that Jones doesn't continue to have its current share of challenges, especially around as it relates to rural health. I'd like to take some time today to make you aware of some of our current challenges of our facility. And to really get straight to the point, Allegheny County's low vaccination rate is truly stressing our hospital, both on the inpatient side and on the outpatient side. With a 42.9% vaccination rate of our county, that's the lowest in New York State. It's having a direct impact on our hospital because we're now witnessing the fourth wave. And many people don't realize we're in the fourth wave of COVID coming through. Historically, some of the first waves didn't affect our rural communities as much, but now we're seeing and feeling the effects of that. I'm quite confident that if we don't have a change in course, we'll see a fifth wave, probably after the holidays. So I'd like to share with you just an example of what we're dealing with. Back on September 12th, when we really started to feel the effects of this wave of COVID, I was in the emergency room on that evening, working with our ED providers because our hospital was full. We're licensed for 49 beds. We have 42 beds that we can fill our ICU and our hospital. We can't take patients for all 42 beds because we just simply don't have the staff for them. We haven't for years actually been able to staff all those beds. But the hospital was full to capacity that we could do safe nursing and provider care. Our ED was full. The waiting room was full. We desperately needed to transfer 3 patients out of the ED because every patient in there that needs a transfer is one more ED bed that I can't take from the waiting room. And I was on the phone with the New York State Surge and Flex line trying to find a bed in all of Western or Central New York at that point. And we never did find a bed for any of those 3 patients. They all stayed in the hospital overnight. And probably one of the scariest things is I was on the phone with the state officials and working directly with Dr. Doyle, Steve Doyle, one of our new UR board certified and emergency medicine providers that we have, one of our new 3, is we could hear on the radio the ambulance coming in with the chest pain. And then you started thinking, where am I going to put this patient? Because we had nowhere to put that patient. Well, of course, luckily I'm surrounded by a lot of people in the emergency medical field. They're a lot smarter than I am. And they were able to juggle the rooms around, juggle the patients around. We had patients in hallways, and they were able to take care of the need at that point. But none of those patients left that ED that day. And since that time, which was really about when the surge started a little bit before that, but that wave, but since then it's never let up. Since then we've been at least 50% of our inpatient medical patients have had a COVID diagnosis. We've never seen this before. One diagnosis for over half of your hospital. Out of that, 80 to 90% of them are unvaccinated. If they were vaccinated and even half of them didn't show up at the hospital, they may have gotten sick, but they may have avoided a hospital stay. I wouldn't be trying to transfer hip fractures to other hospitals throughout the state because I have no other beds for them. And we've done that. We've started to do what's called boarding of patients in the ED. And I don't know if everybody in the room knows what boarding is, but the reason you may not know what boarding is because Jones Memorial doesn't board patients. We've never boarded patients. Matter of fact, I went and canvassed a number of the staff and even volunteers that have been there long before I have, upwards of 30 plus years, and they never remembered boarding patients in the ED. Boarding patients means I have no beds, I have nowhere to transfer them, so they have to stay in our ED overnight, and many times for multiple nights. The problem with that is we only have a certain number of beds in our emergency department. So every patient that we board in the emergency department means one less bed that I can take care of a new patient coming in on an ambulance or a walk-in acute. We've quite regularly been boarding patients since that night. Luckily, our ED professionals were we weren't even set up to have that system. So when a patient's boarded in the ED, a hospitalist is now supposed to take care of that patient, not an ED provider who's supposed to take care of the emergencies. But our hospital wasn't even set up to take them, so they couldn't even see them on what we call our electronic medical record. So we had to scurry to make that work. Thank goodness our new chief nursing officer, Sandra Watkins, was very accustomed to doing this, and she was able to walk the team through this, how to be able to take care of these patients safely. We've had patients in our hospital and ICU as young as 40 on a ventilator. We've had them as young as 30 in our hospital and as old as 90. COVID doesn't discriminate on age. It's unpredictable. I know many people think that it's just going to be a common cold. You don't know that. Our staff are already suffering, or were already suffering, from what we term as COVID fatigue. They're tired. They've been doing this for over a year, short-staffed. Many of my staff, especially on the medical surge units, are working multiple shifts continuously just so that we can try to staff and keep these patients local. Our goal at Jones Memorial and for the University of Rochester, all the affiliates, is to keep all the patients local we possibly can safely. But even when we can't do it safely, or if we run into these problems, what we're finding is even at the University of Rochester, Buffalo General, ECMC, they can't take patients. Their ICUs are full, so we can't transfer these patients. So unfortunately, we had a very young individual that had to sit on a ventilator at Jones, and generally our protocol is to transfer all ventilated COVID patients to a COVID unit. There was no beds for them. So since then, what we've been trying to do as a hospital is we've been trying to reach our community to help us. We've had multiple press releases, and hopefully you've been able to see those. We've been working a lot with the County Department of Health as well to try to make sure we have the correct data, that we're seeing the right data and communicating the same message to make the community aware of the situation. We provided education from our providers. Those are the local providers that we all know, our community all knows. They've received the care from them probably all their lives and that they trust, not some name of somebody out on CNN or Fox or whichever news channel you choose that we don't know who they are. These are people they know and trust and have gotten their health care from. We've published video messages from our providers to our community. We did recently reinstate our drive-through COVID testing with appointments, more for the safety of our patients and our staff, because the volume of the COVID testing has gotten to a point we couldn't allow them to come through our walk-in clinics anymore. We are opening up community vaccine clinics again to help support the pharmacies that have been trying to carry the load of the vaccines in order to get even just a few more. And we're working to put vaccines in our primary care clinics as well. Now that it sounds simple, it's a very big logistical lift, believe it or not, and it has to do with the way the pharmaceuticals are distributed. And we've always been taught not to waste a single vaccine because it was so scarce in the beginning. But now we know if we put those vaccines in the clinics, which we want to do, even if we don't care if we get 2 or 3 vaccines a day, we're going to be wasting vaccine, unfortunately, because of the way it's distributed. So why am I here today? I'm here today to make an ask of our community and to ask the support of our county officials to please encourage vaccinations and not because of any mandate, but just because it makes sense. Your community hospital needs your support, so please support them by getting vaccinated. I'd be willing to take questions if there are any.
Jim, one of the biggest questions I get when I've talked to family members that refuse to be vaccinated, friends that refuse to be vaccinated, they all talk about the science. The science is unpredictable, doesn't tell you how long this vaccine is going to last, that what the effects are 5, 10, 15, 20 years down the road. How would you address those kind of concerns? Because I think it's at the crux of everything that we're facing here, the low compliance rate, that kind of thing.
It is. It's very difficult. One of the challenges we face, and I was just actually discussing this with Senator Borrello and Assemblyman Gilio, who were just at Jones to visit with us and give us our 100th anniversary proclamation. So that was a very, very nice ad for the day. Thank you. And we were discussing this exact same thing. We have an uphill battle. At first, when there was a cry for the vaccine, there wasn't enough vaccines. So we were trying just desperately to push as many vaccines out as we could. But then what ends up happening is you end up with this lull. And we've had this lull, and it's given a lot of access to just misinformation. And unfortunately, it's deeply rooted misinformation from really uncited sources. So what I would say is, if that's their fear, to talk to their local providers. These are individuals that have gone to school for 9, 12 years studying this. 100% of the Jones Memorial medical staff are vaccinated. If they're vaccinated and they know the science, all of our pharmacists, they're all vaccinated. They know the science. Get your questions answered from them, and we'll make them available. Just let us know you want to talk to them.
I think that's good advice. Thank you, Jim.
Yes, sir.
Legislature Decker, thank you for coming in today. And I sympathize with the lack of vaccine. Tyler's been keeping us apprised of that was one of the main factors early that kept our rate from increasing, was they weren't sending vaccines to Allegheny County. But we're glad that's changed around. I see some real positives out there. My wife and I were just recently available through the Cuba Pharmacy to get our regular flu shots. We've been vaccinated for the COVID, but the new flu shots came out and they started pushing those. So I think that may help as well. The fact that that's getting to the pharmacies is what I'm encouraged about. That not only do we have the COVID vaccine, but now we have the regular flu, which affects people, around the holidays and so forth a lot.
Absolutely.
you.
We've been very fortunate to have a great partners in the pharmacies across the county, staying, trying to keep up with the vaccines and making available walk-in clinics for those. And that's why we're opening our vaccine clinic again, because we are asking for more community members to be vaccinated. We want to make it available when it's available for them. I literally don't think she'll mind me sharing this. As I was saying goodbye to the senator and our assemblyman at the front door, one of our doctors, Lou Ann Kay, came whipping right through our group, and couldn't quite figure out exactly what was going on. And she just texted me literally as I was sitting here. She said, "I'm sorry to have interrupted your little get-together, but I had 2 patients that said they would get the vaccine if they could get it right now." She walked them through the front door, through our medical imaging department, into our walk-in clinic, and got them a vaccine. That's how dedicated our providers are to getting this done. And forgive me, Luann, if I wasn't supposed to say that. She's probably watching.
Thanks for me also for coming in. I've read articles, not in New York State, but in other states where providers are talking about prioritizing care for vaccinated patients over non-vaccinated patients. Is that a difficult conversation? Does that come up at all within the U of R system?
It's not a difficult conversation. The bottom line is we would never prioritize care over vaccinated versus unvaccinated. We're here to take care of all of our citizens of the county and beyond. You're never going to hear that. What we're asking for is to be reciprocal of that is to help us by being vaccinated, so that even if you're vaccinated and you end up in the hospital, we'll have room to take care of you. If you're the one coming in on the ambulance with a chest pain, I'll have an ED bed available for you. But no, we would never prioritize care.
Congratulations very much on your new position as the head of the hospital. We applaud that. I want to say thank you as the legislator and chair of the Human Services Committee for your close work with us, with our Department of Health and Community Services during this whole crisis, and the cooperative work that has happened on that medical front and from our end to your end has been fantastic. So thank you very much for that. I also want to commend Jones for being part of the U of R system. That brings expertise here to Allegheny County that we might not have had in the past. And I just want to commend you and your board of directors for the fantastic work that you're doing in terms of bringing new technology right here to Allegheny County. So thank you.
Thank you. It's our pleasure, certainly working with your team. They've been nothing but stellar, and I look forward to being able to come back and talk to you about some of that new technology we'll be bringing to the county.
We'll look forward to it. Thank you.
Okay.
Thank you, Jim. I had appreciated the conversation we had the other day leading up to this, and when I said, hey, why don't you come in and address the board, and I was thinking that working that in maybe sometime between now and the end of the year, and when we talked about having a meeting today, and that could possibly work for Jim, I really felt good about that. And some of the stuff that, the points that Jim shared today, he shared with me, and I didn't know whether he was going to get into that or not, and I'm very glad that you did, because you shared the truth of the situation with Jones and how it relates to Allegheny County and our residents here. And I do know that you are in close contact with our public health director and other agencies within the county, and we appreciate that very much. So open invitation, and that gets the message not only to this board, but those in the chamber and all of those that are able to watch otherwise now. So the challenge would be great enough for a small rural hospital like Jones without a layer of all of the other issues that have to do with COVID and bed space and staffing. And like I said, you came in with all of a sudden, here's the keys to the complex. There you go. At a very, very difficult time. But I can tell you that this board is behind you and Jones Memorial Hospital and anything we can do to help. And the invitation is always open. So thank you. At this time, I would like to have our Emergency Management and Fire Director, Jeff Lucky, come forward and talk about Fire Prevention Month. The floor is yours, Jeff.
200 times more smoke, 8 times faster burning rate than 50 years ago. Today's modern home furnished with modern technology and oil-based products burn faster and present dangers never seen before. What we now see is the synthetic materials dripping off and off-gassing is what's leading to rapid fire spread and rapid combustion. Even 30 years ago, a person had up to 8 minutes to exit from their home from the time the smoke detector went off. Today, a person has less than 2 minutes. There's not a fire department in the world that can respond to your home and rescue you in 2 minutes. UL, Underwriters Laboratories, found the average size room furnished with modern products is fully engulfed in flames in 3 minutes. The same room furnished with items from 50 years ago took 30 minutes to be the same conditions. You have to be ready to react immediately to smoke alarm and head to safe exit as quickly as possible. Not only from the heat and from the fire, but also the poisonous smoking gases that can incapacitate you or your family. These are 7 clear steps that will help you during fire prevention and throughout the year. Here at work, here in this county office building, or at your home. Prevent the occurrence of fire. Make sure the fire cannot develop quickly. The sooner fire can develop, the sooner fire is no longer manageable. A rapidly developing fire also hinders escape to a safe place. Provide fire compartmentalization. Close bedroom doors. Office doors. I just recently was at a fire and the bedroom door is closed. A small little power strip and an Amazon fire started the fire burn up the back of a dresser, but it created enough heat and smoke that when they opened the door, it melted the heat fan unit the next room over. And that's all that burned in that structure. Just that little bit of product they're burning created that much damage. Provide fire alarms. The sooner a fire is signaled, the greater the chance that the fire can still be extinguished without the help of the fire department. In that case there too, their smoke detector alerted them to the fire. That's how they found it. Provide safe escape routes. The principle of a safe escape route is so that people can leave the space that is threatened by fire or smoke as quickly as possible along a safe route into a safe place. Provide extinguishing agents, significant extinguishing agents. Fire hoses, reels, hand fire extinguishers help to extinguish a fire early. This case here, he happened to come home, heard the smoke detector, grab his fire extinguisher, was able to enter that room and extinguish the fire, and actually didn't even call the fire department. I was just asked to go for an investigation later on. Join and support your local fire department. Provide adequate control of maintenance. Regular maintenance and monitoring of correct operations are therefore essential. And again, just, a couple of key things. As I mentioned, close the bedroom doors. That's a key thing really now. We've had a couple of cases where, one person was overcome with the smoke and couldn't get out of the residence. Maybe if his bedroom door was closed, he would have survived. Another case, just minimizing the fire spread. We had in that same place, the fire almost was out before the fire department got there because it ran out of the oxygen due to the heavy smoke. But again, just practice safe. This is year-round activity. Thank you. Thank you.
Thanks, Jeff. And we have a proclamation and just kind of an opportunity to remind people of Fire Prevention Week. And certainly we want to, through you, give thanks for all of the volunteers that we have out there in Allegheny County, fire and EMTs, that we wish to express our gratitude. And, it's a group that we hope never shows up to our house, but when they do, it's nice to know that they're well trained and can take care of things, and we've seen it happen so many times over and over again. And now with new technology, the fire whistle rings and somebody's on. Where's the alarm? I think there's apps. Where's the fire? Going. But I'll share an interesting. This was just a couple of years ago that made me feel good that this type of education was going on. Was a young neighbor girl came over and wanted to meet with myself and brought her mother over, but wanted to use our front porch as the common meeting area if anything should happen at their house. And I said, certainly, we're never there, but that's a good spot to meet. But anyways, her mother said it was obviously a class that was going through preparedness and what do you do in case of this and that, but it was to have a neutral place, a safe place to meet, if anything happened in their house. So it made me feel good that kind of education was still going on and that she was taking initiative to come over and find a flat spot at our place if something like that happened. But anyways, a good group that we're glad they're there. We hope they don't come to our house, but if they do, it's nice to know that they're prepared for that. Fire Prevention Week, Whereas in the United States, the first presidential proclamation of Fire Prevention Week was made in 1925 by President Calvin Coolidge. And whereas each year during the month of October, Allegheny County Fire Services takes this opportunity to remind the citizens of Allegheny County of the devastating impact fire has on each of us. And whereas during the year 2020, our Allegheny County Fire Department volunteers responded to 140 structure fires, 336 motor vehicle accidents with injury, 56 vehicle fires, 119 outside fires, and 403 fire alarms. The total number of calls for service was 3,006 fire calls. These were answered by the 1,201 dedicated volunteers we have here in Allegheny County. And whereas Allegheny County has 28 fire departments that respond to the calls, the members of the Allegheny County Fire Departments are ready to respond to save lives and property to those in need 24 hours a day, 7 days a week. And whereas this year's Fire Prevention Month theme from the National Fire Prevention Association is Learn the Sounds of Safety. And whereas this year's Fire Prevention Week is October 3rd to October 9th, and the month of October is Fire Prevention Month. And whereas individual fire departments may be holding open houses to offer their communities the chance to see and talk to the first responders of their district and hands-on opportunities. And whereas the members of the fire departments, fire investigators, deputy coordinators, and EMS providers engage in many hours of fire prevention through open houses, school demonstrations, and festivals to share the information with the public, to use the week of October 3rd through the 9th to educate the community on cooking hazards, the dangers of unattended cooking, and precautions they can take to prevent cooking-related fires. Whereas it is appropriate to recognize the value and accomplishments of the fire service providers by designating Fire Prevention Week. Now therefore, I, Curtis W. Crandall, Chairman of the Allegheny County Board of Legislators, hereby proclaim the week of October 3rd through the 9th as Fire Prevention Week. Signed, sealed, and delivered. Thank you so much.
On your desk is a report of tax bill corrections approved by the county administrator in September, as well as a report of interfund transfers approved by the county administrator. County Treasurer Terry Ross filed a copy of the EFPR Group's audit of the financial statements of Allegheny County for the year ended December 31st, 2020 in my office on September 28th. We received correspondence from the New York State Association of Counties awarding Allegheny County 5 complimentary registrations to the 2022 Legislative NISAC Conference, a $1,250 value in honor of Allegheny County having the strongest attendance at the 2021 Fall Seminar. We received a joint press release issued by the Allegheny County Office for the Aging and Ardent Solutions announcing their town hall listening sessions. And we received correspondence from 3+1 announcing that Allegheny County is the recipient of the prestigious 90+ Cash Vest Award for 2021. This award signifies excellence in the implementation and management of all liquidity in the public marketplace. Chairman Crandall just read the proclamation declaring October 3rd through the 9th as Fire Prevention Week, and the month of October is Fire Prevention Month.
Introduction of legislation by legislator Philip Stockin.
Yes, sir. I would like to introduce local law intro number 3-2021, print number 1, a local law to provide increases in the compensation of certain county officers.
Thank you. Resolutions?
Resolution intro number 24521, resolution setting date of public hearing on a local law to provide increases in the compensation of certain county officers. This resolution is being offered by the Ways and Means Committee and has committee approval.
Motion is made by legislator Stockin, seconded by legislator Havey. Discussion? This is setting a date of a public hearing. This can be voice voted. All in favor say aye.
Aye.
Any opposed? Carried. Resolution is passed.
Resolution intro number 24621, resolution setting date of public hearing on a grant application seeking a $500,000 grant under the New York State Homes and Community Renewal Development Block Grant Program. This resolution is being offered by the Ways and Means Committee and has committee approval.
Motion is made by legislator Stockin, seconded by legislator Havey. Discussion? Again, this resolution is just setting a public hearing. We can voice vote this. All in favor say aye.
Aye.
Opposed? Carried. Resolution is passed.
Resolution intro number 24721, resolution directing notice of district review of agricultural district number 2 pursuant to section 303A of the Agriculture and Markets Law. This resolution is being offered by the Resource Management Committee and has committee approval.
So moved.
Motion is made by legislator Decker and
Second.
seconded by legislator Graves. Discussion? We can voice vote this as well as the, we'll have further legislation to accept this. All in favor of this say aye.
Aye.
Opposed? Carried, and that resolution is passed.
Resolution intro number 24821, acceptance and appropriation of a donation from the Allegheny County Senior Foundation on behalf of the United Way for the Office for the Aging. This resolution is being offered by the Human Services and Ways and Means Committees and has both committees' approval.
Motion is made by legislator Hopkins and seconded by legislator Burdick. Discussion?
Mr. Chairman, can I make a comment?
Yes.
The revenue number on this should be 2705 instead of the 1972. If someone would please make that amendment.
2705.
Yes, instead of the 1972 that's in the revenue account number.
It's,
I think we fixed those in committee. They just made it onto the resolution incorrectly.
that's from our county treasurer, Terry Ross. So if we could entertain a motion to amend this resolution, that in the second resolved, the number 1972 is replaced by 2705. Motion is made by legislator Dibble, seconded by legislator Hopkins. All in favor of that say aye.
Aye.
Opposed? Carried. And on the amended resolution, further discussion? Roll call?
Mr. Decker,
Yes.
Mr. Dibble, Mr. Graves,
Yes.
Mr. Harris, Mr. Havey,
Yes.
Mr. Healy,
Yes.
Mrs. Hopkins,
Yes.
Mr. Ricky,
Yes.
Mrs. Root,
Yes.
Mr. Stockin,
Yes.
Mrs. Burdick,
Yes.
Mr. Crandall.
Yes.
12 ayes, 3 absent.
Resolution is passed.
Resolution intro number 24921, acceptance and appropriation of supplemental funding from the Unmet Needs Grant for the Office for the Aging. This resolution is being offered by the Human Services and Ways and Means Committees and has both committees' approval.
Motion is made by legislator Hopkins, seconded by legislator Burdick. Discussion? Roll call?
Mr. Decker?
Yes.
Mr. Dibble?
Yes.
Mr. Graves?
Yes.
Mr. Harris?
Yes.
Mr. Havey?
Yes.
Mr. Healy?
Yes.
Mrs. Hopkins?
Yes.
Mr. Ricky?
Yes.
Mrs. Root?
Yes.
Mr. Stockin?
Yes.
Mrs. Burdick?
Yes.
Mr. Crandall?
Yes.
12 ayes, 3 absent.
Resolution is passed.
Resolution intro number 25021. Acceptance and appropriation of New York State DOT FTA Section 5311 Rural Areas Capital Agreement number C004104 funds. This resolution is being offered by the Ways and Means Committee and has committee approval.
Motion is made by legislator Stockin, seconded by legislator Dibble. Discussion? Roll call?
Mr. Decker?
Yes.
Mr. Dibble? Mr. Graves?
Yes.
Mr. Harris?
Yes.
Mr. Havey?
Yes.
Mr. Healy?
Yes.
Mrs. Hopkins?
Yes.
Mr. Ricky?
Yes.
Mrs. Root?
Yes.
Mr. Stockin?
Yes.
Mrs. Burdick?
Yes.
Mr. Crandall?
Yes.
12 ayes, 3 absent.
Resolution is passed.
Resolution intro number 25121, reappropriation and reallocation of unspent CARES Act 2020 funds for the Allegheny County Bus Transportation Program. This resolution is being offered by the Human Services and Ways and Means Committees and has both committees' approval.
Motion is made by legislator Hopkins and seconded by legislator Burdick. Discussion? Legislator Dibble?
Thank you. This is a great system for the county, and hopefully more people take advantage of it once the word gets out there. The bus stations are coming in, the stops, and, you know, if you're a senior, you can ride it pretty reasonably. If you're going around the county for shopping or going to Olean or whatever else, check it out. Thank you.
Thank you. Further discussion? Roll call?
Mr. Decker?
Yes.
Mr. Dibble?
Yes.
Mr. Graves?
Yes.
Mr. Harris?
Yes.
Mr. Havey?
Yes.
Mr. Healy?
Yes.
Mrs. Hopkins?
Yes.
Mr. Ricky?
Yes.
Mrs. Root?
Yes.
Mr. Stockin?
Yes.
Mrs. Burdick?
Yes.
Mr. Crandall?
Yes.
12 ayes, 3 absent.
Resolution is passed.
Resolution intro number 25221, adjustment to the expanded in-home services for the elderly program, budget for the Office for the Aging. This resolution is being offered by the Human Services and Ways and Means Committees and has both committees' approval.
Motion is made by legislator Hopkins and seconded by legislator Burdick. Discussion? Roll call?
Mr. Decker?
Yes.
Mr. Dibble?
Yes.
Mr. Graves?
Yes.
Mr. Harris? Mr. Havey?
Yes.
Mr. Healy?
Yes.
Mrs. Hopkins?
Yes.
Mr. Ricky?
Yes.
Mrs. Root?
Yes.
Mr. Stockin?
Yes.
Mrs. Burdick?
Yes.
Mr. Crandall?
Yes.
12 ayes, 3 absent.
Resolution is passed.
Resolution intro number 25321, adjustment to the community services for the elderly budget for the Office for the Aging. This resolution is being offered by the Human Services and Ways and Means Committees and has both committees' approval.
Motion is made by legislator Hopkins and seconded by legislator Burdick. Discussion? Roll call?
Mr. Decker?
Yes.
Mr. Dibble?
Yes.
Mr. Graves?
Yes.
Mr. Harris? Mr. Havey?
Yes.
Mr. Healy?
Yes.
Mrs. Hopkins?
Yes.
Mr. Ricky?
Yes.
Mrs. Root?
Yes.
Mr. Stockin?
Yes.
Mrs. Burdick?
Yes.
Mr. Crandall?
Yes.
12 ayes, 3 absent.
Resolution is passed.
Resolution intro number 25421, adjustment to the New York Connects expansion and enhancement budget for the Office for the Aging. This resolution is being offered by the Human Services and Ways and Means Committees and has both committees' approval.
Motion is made by legislator Hopkins and seconded by legislator Burdick. Discussion? Roll call?
Mr. Decker?
Yes.
Mr. Dibble?
Yes.
Mr. Graves?
Yes.
Mr. Harris? Mr. Havey?
Yes.
Mr. Healy?
Yes.
Mrs. Hopkins?
Yes.
Mr. Ricky?
Yes.
Mrs. Root?
Yes.
Mr. Stockin?
Yes.
Mrs. Burdick?
Yes.
Mr. Crandall?
Yes.
12 ayes, 3 absent.
Resolution is passed.
Resolution intro number 25521, budget adjustment within community services accounts due to an increase in state aid from the Office of Addiction Services and Supports. This resolution is being offered by the Human Services and Ways and Means Committees and has both committees' approval.
Motion is made by legislator Hopkins and seconded by legislator Burdick. Discussion? Roll call?
Mr. Decker?
Yes.
Mr. Dibble?
Yes.
Mr. Graves?
Yes.
Mr. Harris? Mr. Havey?
Yes.
Mr. Healy?
Yes.
Mrs. Hopkins?
Yes.
Mr. Ricky?
Yes.
Mrs. Root?
Yes.
Mr. Stockin?
Yes.
Mrs. Burdick?
Yes.
Mr. Crandall?
Yes.
12 ayes, 3 absent.
Resolution is passed.
Resolution intro number 25621. Transfer of funds within employment and training accounts. This resolution is being offered by the Planning and Economic Development and Ways and Means Committees and has both committees' approval.
Motion is made by legislator Root, seconded by legislator Ricky. Discussion? Roll call?
Mr. Decker?
Yes.
Mr. Dibble?
Yes.
Mr. Graves?
Yes.
Mr. Harris? Mr. Havey?
Yes.
Mr. Healy?
Yes.
Mrs. Hopkins?
Yes.
Mr. Ricky?
Yes.
Mrs. Root?
Yes.
Mr. Stockin?
Yes.
Mrs. Burdick?
Yes.
Mr. Crandall?
Yes.
12 ayes, 3 absent.
Resolution is passed.
Resolution intro number 25721, approval of agreement with Dave's Diner is a food service establishment for the Office for the Aging. This resolution is being offered by the Human Services Committee and has committee approval.
Motion is made by legislator Hopkins and seconded by legislator Burdick. Discussion? Roll call?
Mr. Decker?
Yes.
Mr. Dibble?
Yes.
Mr. Graves?
Yes.
Mr. Harris? Mr. Havey?
Yes.
Mr. Healy?
Yes.
Mrs. Hopkins?
Yes.
Mr. Ricky?
Yes.
Mrs. Root?
Yes.
Mr. Stockin?
Yes.
Mrs. Burdick?
Yes.
Mr. Crandall?
Yes.
12 ayes, 3 absent.
Resolution is passed.
Mr. Chairman,
Yes. Legislator Decker?
at some point, I would like to see a report on how effective this program is, how many people are taking advantage of it. It seems like a good program, but the numbers will tell the difference.
Yeah. I'm sure once we get into that within the committee reports, there's going to be plenty of time to find that out. Get a little track
month?
record to it.
Thank you.
Thanks.
Resolution intro number 25821, creation of one full-time position of human resource assistant. This resolution is being offered by the Personnel and Ways and Means Committees and has both committees' approval. It was not pre-filed and it will require a 2/3 vote to consider from the floor.
Motion on the 2/3 made by legislator Root, seconded by legislator Dibble. All in favor of that, say aye.
Aye.
Opposed? Carried. On the resolution itself, motion is made by legislator Havey, seconded by legislator Harris. Discussion? Roll call?
Mr. Decker?
Yes.
Mr. Dibble?
Yes.
Mr. Graves?
Yes.
Mr. Harris? Mr. Havey?
Yes.
Mr. Healy?
Yes.
Mrs. Hopkins?
Yes.
Mr. Ricky?
Yes.
Mrs. Root?
Yes.
Mr. Stockin?
Yes.
Mrs. Burdick?
Yes.
Mr. Crandall?
Yes.
12 ayes, 3 absent.
Resolution is passed. How would you like your audits?
Collectively and by totals, please.
Collectively and by totals, moved by Legislator Stockin, seconded by Legislator Healy. All in favor of that, say aye.
Aye.
Opposed? Carried.
General government support, 171,270.90. Education, 42,422.70. Public safety, 82,908.65. Health, 233,840.30. Bus transportation, 2,392.80. Economic assistance and opportunity, 670,612.07. Culture and recreation, 32,565.04. Home and community services, 33,105.91. Payroll and our general fund totaled 1,269,118.37. Payroll and taxes totaled 1,112,942.53. Our capital funds totaled 476,472.74. Our other funds totaled 1,093,852.10 for a grand total of 3,952,385.74.
Motion to pay the bills made by Legislator Root, seconded by Legislator Dibble. Discussion? Roll call?
Mr. Decker? Yes. Mr. Dibble?
Yes.
Mr. Graves?
Yes.
Mr. Harris? Yes. Mr. Havey?
Yes.
Mr. Healy?
Yes.
Mrs. Hopkins?
Yes.
Mr. Ricky?
Yes.
Mrs. Root?
Yes.
Mr. Stockin?
Yes.
Mrs. Burdick?
Yes.
Mr. Crandall?
Yes.
12 ayes, 3 absent.
Resolution is passed. Reminder for those on public safety that there is a public safety committee meeting that will be shortly following our recess here, or our adjournment. I believe that is reasonably short. Anything else to come before the board before we adjourn? Legislator Dibble?
Thank you. Going back to resolution about Dave's Diner, they're good food. It's probably too late to catch up to Tiny Tim.
You might have missed the boat on that one.
Sounds delicious. As there appears to be no further business, Mr. Chairman?
I think we have, the clerk is, her red light is on, so we draw to attention.
I was just going to remind everybody that the artisan tour is this weekend.
Thank you. Good reminder.
With that, Mr. Chairman, as there appears to be no further business, I move we adjourn.
Motion to adjourn made by Legislator Graves, seconded by Legislator Havey. All in favor say aye.
Aye.
Opposed? We are adjourned.